Professor Hough, thanks for being here with us today.
Thank you so much.
A lot of the both professional and academic work you've done has been in the area of social services, including people with disabilities and chronic health conditions. Healthcare has been a big issue that's intersected social services in the presidential campaign. Could you tell us a little bit about how you're viewing the campaign and what you see going on with each candidate's policy proposals?
Absolutely. There's definitely a lot of complexities with the healthcare issue overall. And kind of what has been talked about during this campaign is no exception. I think there's a couple of things that folks with disabilities or health conditions or people who work with those populations need to be aware of as far as health coverage. On the Romney side, there's this kind of talk about changing Medicare, looking at it differently from the Affordable Health Act that was passed by Barack Obama. And the idea that Romney has is making Medicare into a voucher program so that folks who are receiving Medicare, either because they're disabled and younger or elderly, would have vouchers to buy into the Medicare program, thinking that that might be a better way of running the program. There would be this kind of traditional parallel program that would be also a Medicare program. The problem with that is that most likely folks who have disabilities or chronic health conditions will end up in traditional Medicare, where private insurance companies will be more interested in the folks who are healthy, and so their voucher buying power will be higher. The Obama side is definitely sticking with the Affordable Health Care Act, which did a couple of positive things for Medicare. One being that Medicare will now pay for preventive cost services. So a little more incentive for everybody on Medicare to go in for annual exams and think about prevention services, things like flu shots. The other thing it did for folks on Medicare is that it closed what has been referred to informally as the donut hole of prescription drug coverage. So up until about $3,000, people who are covered by Medicare do get prescription drug coverage now. Then there's this gap in between that and catastrophic need for prescription drug coverage. So seniors who fall into that gap, who maybe are dealing with a chronic health condition, could end up paying out of pocket a lot of money, up into the thousands of dollars each year. For prescription drugs, and for somebody who could be living on $1,500 to $2,000 a month, it can be a lot of money.
So it sounds like these policy differences plug into a broader debate over whether the initiative for policy should be more at the national level or rest more with the states. Does that make sense to you?
Absolutely, absolutely. The Romney campaign is proposing that Medicaid be turned over to the states in the form of block grants. So that the thinking behind it is that states know best what's right for their state as far as health care. So instead of having federal guidelines, that would go to the states. The Obama side of things is still saying there needs to be consistency, there needs to be oversight at the federal level. That the block grant idea is probably not a good idea, especially for folks with disabilities or health conditions. If there are cost reductions needed, and there probably will be, it's going to be those most vulnerable populations that are going to have a hard time getting the care that they need.